Hi, my name is Dr. Ramanesh Mageswaran, consultant anaesthetist in Columbia Asia Puchong. Having a baby can be a very special and exciting time for any mother. Different women go through labor in a very different way. Different women experience pain in a very different way. The contraction of the uterus which causes the pain. Your pain will be assessed by using a pain scale like this one. 0 showing no pain, 10 showing the worst possible pain. The aim for labor analgesia or labor pain relief is to achieve a pain score of less than 4. When you go in your labor, your midwife or your nurse will start you on some relaxation techniques. For example, some breathing exercises, some massages and some stretches to make you feel more comfortable and reduce the pain. Then you also have Anthenox. Anthenox is a mixture of oxygen and nitrous oxide gas which will be delivered through a mouthpiece, and you can use it at any time, and this will help you feel more relaxed. But if your pain gets stronger, your obstetrician will start you on a stronger medication, a painkiller, which will be given through your arm. If the pain still doesn't subside, normally the obstetrician will refer to your anesthetist for epidural labor analgesia. So epidural analgesia is normally done by a trained anesthetist in the labor room. Epidural is basically putting a numbing medicine or local anesthetic into your epidural space, which blocks the lower part of your body. Epidural works basically locally and blocks the nerves which transmits pain from the uterus and vagina. And since the epidural works directly in the nerves in your back, very little medication gets to your baby, and it's very safe to breastfeed after an epidural. First, your anesthetist will come and see you and get your consent before the procedure. You will need an IV cannula or a plastic tube in your hand and with a drip running. We will position you in a sitting position, giving you a pillow to hug, like hugging a teddy bear, with a curved position so it's easier for the epidural tube to go and get inside your epidural space. Then we will clean your back with an antiseptic solution and put sterile drapes on you. Then we will give you a numbing medicine, a local anesthetic around your skin. That might feel like a bee sting or small insect bite. Then we'll introduce another needle and put in the epidural tube into the epidural space where the medications get infused. Sometimes you might feel some pressure and some strange sensation running down your leg. Don't worry, just inform your anesthetist. It's very important to remain still during the procedure. This procedure typically takes about 30 minutes and about 15 minutes for the medication to work. But if you have obesity, scoliosis or deviated spine, it might take a little longer. It provides an excellent pain relief. There are many studies that have shown that epidural does not significantly slow down labor. There's no evidence that epidural increases the likelihood of cesarean section. If you have to go in a cesarean section, we just have to top up the epidural with stronger medication. Sometimes even with the epidural you can feel some pelvic pressure, but that is good, it helps you push out the baby. Back pain is common in most of the pregnancies. Epidural does not cause general back pain. You might experience some temporary soreness in the epidural site for a few days, and then it should subside after that. Epidurals are usually safe, but with any medical procedures, side effects and complications can occur. It's common to feel some itchiness and some shivering after an epidural. It's because of the medication given. You might feel your legs feeling a bit weak and tired, but it'll subside once the epidural is offed. Your blood pressure might drop a little, but that might make you feel slightly nauseated. We will treat it with some fluids and some medication. You might lose bladder control, but a nurse in the labor room will put a urine tube to drain your urine out. Sometimes the epidural might not completely work and might be inadequate, which will need some fine-tuning and resighting of the epidural catheter. Rarely, not common, 1 in 100 women will have severe headache, which is called post-dural puncture headache after an epidural, which can last several days if it's not treated. Severe complications with epidurals such as permanent nerve damage is very rare, seen in 1 in 200,000. Bleeding and infection after epidural is also very rare, seen in 1 in 200,000. Thank you very much for watching this video. We want to give you a positive, comfortable and a safe experience during your labor. You can always consult your obstetrician or your anesthetist for further information.